High blood pressure is a silent killer. According to the American Heart Association, 77.9 million people in America alone have high blood pressure. That's 1 in every 3 people. Today I'm going to show you how to take blood pressure, as it is extremely important to monitor it. Taking blood pressure must be done properly in order to ensure accurate readings, so pay careful attention as I show you what you need to take blood pressure, how to find a brachial pulse, how and where to place your BP cuff, how to hold your stethoscope, and finally how to actually take blood pressure. I have been trained by my sister, who is a state certified CNA, as well as my assistant today, on how to take blood pressure. First, you will need several things in order to take blood pressure. The first thing you will need is a blood pressure cuff of the appropriate size, whether extra large, adult, or child size, along with a sphygmomanometer. You will also need a stethoscope. Once you have these things, you'll want to have your subject sitting for 3 to 5 minutes prior to taking their blood pressure, as this helps the blood pressure be as even as possible. The first step we will do is find the brachial pulse on our subject. We'll choose one of the subject's arms and we'll bring it out completely straight like this. This exposes the brachial artery closer to the skin so that it is easier to find the brachial pulse. Now with 2 or 3 fingers, we'll place them on the pinky side of our subject's arm, approximately in the elbow area, and press with medium hard firmness in order to find our brachial pulse. Once we have found our brachial pulse, we can go on to applying the BP cuff. It is very important that as we apply the blood pressure cuff, that it is neither too tight nor too loose. If it is too tight, then the blood pressure reading will be abnormally high. If it is too loose, then the blood pressure reading will be abnormally low. Once we have properly applied our blood pressure cuff, we can then attach our sphygmomanometer to its designated strap. Now that we have that done, we can go on to how to use our stethoscope. Now we can take our stethoscope and place the buds in our ears facing away from ourselves. Then we can take the diaphragm of our stethoscope between our first and middle finger. This allows the pulse to be heard on the patient without any interference from our own pulse. We'll place the diaphragm right where we found the brachial pulse earlier on. So right about there. And sometimes, depending on where the blood pressure cuff has been placed, the blood pressure cuff will overlap the diaphragm. This is perfectly fine. Now, in our opposite hand, we will take the pump for our blood pressure cuff. You'll see that there is a small knob right here. We will want to turn that all the way to the right so we can pump up our blood pressure cuff. Now, at this point, we can ask our subject, do you know your normal BP levels? So our subject doesn't know their normal BP levels. So what we'll do is, while we're pumping the sphygmomanometer up, we'll pump it up to 160 millimeters of mercury. That is the unit for which the pressure is measured. If they did know their normal blood pressure, then we would pump it 20 millimeters of mercury past this. As we pump the blood pressure cuff up, we're going to be listening for 2 things: the systolic and the diastolic pressure. The systolic pressure will be the first thump that we hear in tandem with the ticking of the dial up and down. The diastolic pulse will be the last pulse we hear, ticking in time with the dial. I'm now going to pump our cuff up to the 160 millimeters of mercury we talked about before, and I'm going to slowly let it down. The first thump I heard was around 100, continuing to let it down and listening. The last pulse I heard was around 68 or 70. So we will mark the first thump of 100 as our systolic pressure and our last pump of around 68 as our diastolic pressure, and we have successfully taken our subject's blood pressure. Now that we have successfully taken blood pressure, let's go over some of the main points. First, we will need a blood pressure cuff with a sphygmomanometer and a stethoscope. Our first step is finding the brachial pulse on our subject. Our second step is placing the blood pressure cuff with the appropriate tightness around our subject's arm. Our third step is using our stethoscope to listen to our brachial pulse. Our fourth and final step is pumping up our blood pressure cuff to the appropriate millimeters of mercury and then slowly letting it deflate in order to listen to the systolic and diastolic blood pressure. Thank you for watching this video, and a thanks to my sister who trained me on taking blood pressure.